we'd like to move on to the second half of our session today. And I want to introduce my colleague and friend, Nicole Pratt, who will be discussing FASD, fetal alcohol spectrum disorder, and lead poisoning prevention. And I believe we're going to do a little mindfulness as well. So Nicole, without further ado, take it away. I will mute myself.
I'm going to share my screen. Slideshow. Everybody sees my screen? You see my screen? Okay. Well, thank you, everyone. And I think this is a great follow-up to what Dr. Dumas just talked about, more on the clinical side of things and the medical side of things. And again, this is presented through our Empowering Women project that is funded through the Office for the Prevention of Developmental Disability. And our project is definitely focused on committing to creating women as leaders. Not that we don't care about men, but the project is focused on women as leaders to enhance their family. And so their spouses, their partners, their children. And so now we're going to talk about pretty much the more kind of organic way, how we can help our mental health. And sometimes that goes alongside of the medical pieces and, natural pieces. And so again, put your information in the chat box, questions, and so on and so forth. And there are people in the chat box that will respond to you. And so when we look at this, so in these times, nobody knew that on March 10th or 11th, what day that was, that the world was going to change so significantly, right? And for women, us as women, it changed our lives drastically about how we manage our households. We had to become teachers, literally. In some cases, the physical therapist, the occupational therapist, the speech therapist, the teacher, the reading teacher, all these things. And for some women that I know and have spoken to, that was a very overwhelming process for them. And as the doctor stated, we will definitely see women, come forth with more anxiety and more feeling of the isolation pieces and feeling depressed and just having been home for so long. And now they have a new term, quarantine fatigue. And I believe it's real. And so, missing those connections with people and loved ones, not being able to go see your family, only be able to go to the supermarket. And now we have to wear a mask when we go to the supermarket. And for people who already are dealing with anxiety issues and things like that, that makes them even more anxious. And if you weren't anxious before, you are more anxious now. And so we have to also, in addition, keeping up with the state of New Jersey and the things that they require us to do. And then what is normal? Now we're getting back to being able to go to different places, but there's still a very heightened awareness of the COVID-19 is still here. We still have to wear masks. We still have to wash our hands. We still have to, use hand sanitizer. So it will definitely increase our level of stress. And there are many people that, has a process when they get ready to go, just to go to the supermarket. You're already feeling stressed and anxious before you even walk out the door. You're starting that process when you are, especially for women, do I bring my child with me, or can I get someone to be with my child, or do I bring my child and how do I protect my child? And so there's a lot of thought processes going on with ongoing changes. And so we're living in the era of a new normal. We've heard this term a lot with the professionals that we hear on TV and the doctors. The previous idea of being productive, what does that mean? If you're working from home, or if you weren't working from home before, you're working from home now, and then in addition to being your child's teacher, and if you have more than one child that are in different grade levels, That is a lot of stress and a lot of things that we've had to adapt to, which is now the new normal. And now parents are thinking forward, is my child going to school in September? What does that look like? There's a lot of questions around that. And so, but the thing is, we have to, as women, because we take on a lot, how do we be kind to ourselves? How do we be patient? Because we know that because of the stress, it could cause our anxiety to be so high that we can be short tempered at times. And so we have to be patient with ourselves. We have to take time for ourselves. And we have to be prepared for so many changes, as we know in this world, that so many things have changed for us as women, as the primary care providers for the majority. Not that there are men who are primary care providers, but majority of them are female women. And then in the new normal of telehealth. And so going to medical appointments, many of them now are virtual if you don't have to get a hands-on medical process at the doctor. And then we had teletherapy if your child has had therapy in person, but now your child has teletherapy at home, whether that be from mental health services that you were getting services from, or therapy from school, the PT or OT. Now it's teletherapy. So there's a lot of different changes. And then with jobs, jobs have become, some people lost their jobs. And so the rates of unemployment we knew has gone up, which caused a lot of people to have anxiety. People who normally, again, majority of women who had to go to food banks or the farmers markets who've been doing free, I know at least in Mercer County, I don't know about other areas, providing free fruits and vegetables at a specific location and time. Just people coming in droves and getting this food because they have a need, because they don't have enough funding coming in or finances coming in into their home. And so with all those things, we do have to stay informed. That's really important. And so we have to balance how much news that we watch. We have to balance, because it will cause all these things, our anxiety levels to go up. Checking your information resources. We know that there's information out there that if it doesn't sound that true, then it's probably not. So we definitely want to make sure that we are looking at the sources that it's coming from. And again, pull back from watching so much news. We have to learn how to take those breaks, because that is one way we'll be able to relax and control our anxiety. Watch something fun, binge watch a show you haven't been doing, do things that you didn't normally do. And a lot of people have done that. Going back to reading their books and sitting outside in the garden, people starting to do gardening, things like that. Looking at, and again, going back to looking at those reliable resources, the CDC, we know they have, email information, the World Health Organization, New Jersey, the Department of Health, or if you're here from another state, your Department of Health, or the federal office of Department of Health, and SPAN Parent Advocacy Network. We have a wealth of information on our website, and we provided you a lot of the resources links. Your state and local and city and county offices, really being connected to so much, because I can only speak to New Jersey. We have 21 counties, and in each 21 counties, there's different level of resources and supports there, but they are there. And so really being able to be tied into those things. And so we look at also the impacts of our communities. So we know that information has come out around the racial disparities that have been revealed. It's always been there. It's just more in the forefront now because of the COVID, around healthcare and housing and the economic opportunities. People who work at grocery stores and things of that nature still had to go to work because one, they had to feed their family, and people still needed to buy those things. And so the exposure that they had to more people could expose them to the virus. And as we see now, there are places that have been opening up more and more people being exposed. But at the same time, there are people who have been at risk of economical hardship, who've lost their jobs, trying to get unemployment. Unemployment had been, because of the system, because so many people had been collecting or putting their application in for unemployment. almost broke, I think, the electronic system but I think they've got it under control now, I believe. But also looking at the structural racism that has been shown through the COVID-19 around the disparities around African American populations who we saw reached the all-time high of getting the COVID. So we know that they've been collecting data on that. And again, it will vary even in New Jersey. It'll vary by location, what those numbers look like. And then also looking at the current communities and for the long-term standing and equitable conditions of the communities that are impacted by the COVID-19, around the economical pieces, the healthcare pieces. But we did see that in New Jersey, they really ramped up people having access to getting their health care, making sure children had health care, making sure families were able to get health care if they had lost their job, being able to access the healthcare marketplace that New Jersey has. And so the resources are there, and then organizations that are there to support individuals to be able to get connected to those resources. There are so many organizations that are doing so many things virtually out there. We have many of them here at the webinar. We at SPAN, we collaborate with many of those organizations that are community organizations. We collaborate with state organizations. And so they are there to give support and help families get through a lot of these things. And we know, again, with the housing insecurity, we know that there's housing financial support here in New Jersey for families to get that support that they need to help pay their rent. Essential workers' roles not valued. And we want to make sure that they do have value, that we are valuing a family who maybe has a nurse or a doctor working. And so thanking them for their service, and just thanking anyone who has, even when when I go to the supermarket, I ask the person on the register, how are you doing? Because they are on the front line. They are the ones giving me a service to buy the food, and making sure we have access to healthcare. And again, we know that there's people with food insecurity and food deserts because they don't have really great grocery stores maybe within the area of which they live. And so to get the good food, they are reliant on many of the food banks and the farmers markets that are providing the food for the families to get healthy food to eat. And so with women are more likely to feel the negative impact, as I stated before, 16%. This is from resources from the United Nations, the World Health Organization, NPR, CNN. So these facts come from the information that they've gathered, because we've taken on a lot more. And again, we know that the sheltering in place definitely has had a rise in domestic violence cases, abuse of children, which a majority affect the women, and we'll have more information on domestic violence tomorrow. And then women who are likely to hold the frontline jobs in healthcare than men. We see majority of the people in healthcare that you see on TV are women, but there are men. There are men, nurses, doctors, other healthcare workers that are working, and 76% of all health workers and 85% are nurses and nurses aides. So that's a lot of people working in the healthcare to keep us healthy. And then women account for 60% who lost their job in March. That's a large amount of women losing their job and feeling stressed that they're not able to handle their household. And we know that there are many women that are single parents, that they are the primary care provider for their family, who are the ones that are making the money, and to have lost your job and then waiting for unemployment, that was a big blow for many women who were struggling to take care of their family, which could cause stress, anxiety, all these things. And we know that the reproductive rights in some states considered are non-essential services. So again, now that we have these non-essential services beginning to come back again, and there's a lot of people, there were some stats that came out, a lot of people, a lot of women that did not go for their follow-up appointments because they were afraid to go and get their appointments that they needed to get done for fear of getting the COVID-19 virus. And so, they're saying now, please go get your, your blood work, your appointments, go get those things because those are really important. I saw a news story. It was about, I think it was last week, about a woman who was having some um, pain in her chest and some numbness and things of that nature. And she had those symptoms for about a couple, like 2 or 3 weeks, I believe it was. I'm not exactly sure. But she didn't know she was having a heart attack because she didn't want to go to the hospital. She didn't want to go to the emergency room. But finally, when she saw her doctor, after a few weeks, the doctor said, you had a heart attack. And so, the message they were getting across, if you have those symptoms, no matter what is going on in the world, you have to go get the doctor, get checked out. Because we know as women, the signs of a heart attack are different signs than for men. We can have very subtle signs, sometimes back pain. Sometimes we can just contribute that to just, I must have picked something up wrong or things like that. So we have to listen to ourselves, right, when those things are happening. And so when we look at the components of health, there are many different things. Health is not just about the medical pieces. And we look at the framework of health. We look at the emotional pieces, how things are affecting our relationships with our families, our partners, our children. We also look at the environment, as I spoke about, the environment in which you live, in your home, outside your home, financial health, people losing their jobs and not having that enough money, or if they've been using their savings money, but now they're running low. But we also look at the social pieces. How do we develop good social awareness, social well-being for ourselves and social belonging when we've been in this isolation? Even though the stay-at-home order has lifted in New Jersey, there are a lot of people that are still going to be isolating themselves at home, because if you have a pre-existing health condition, you're going to be very mindful and very aware of what you need to do to protect yourself and to protect your family. And to look at your intellectual skills, the abilities to find other ways of using your mind and just connecting to other people. And the physical pieces, dietary. We know that, there's been a lot more snacking going on. But, obviously we had to still take care of ourselves. We had to get good sleep and eat good nutrition, as the doctor noted. And work, if we are working from home or being able to go back to our job, it is definitely a new normal. There are some places where they have now plexiglass plates up around the desk, and you have to wear a mask and all these different things, that you definitely have to connect to your job about what that looks like. But we also want to just think about, things that we can do to help calm ourselves. We know that a lot more people have been doing exercises at home. There's a lot more yoga going on to create mindfulness, to relax ourselves, to give ourselves more of a peace of mind when we're waking up or going to sleep, and breathing exercises, just those things to give ourselves some time for us. And that's really important that we do that. And so when we look at, here is some calming stress through mindfulness. And here's some places where you can find things. And we look at mindfulness as a steering wheel of our attention. And on your phone, you have apps, right? They can give you some mindfulness, and you can do breathing exercises just to calm ourselves and to go through, lowering our heart rate and just really being aware of our feelings and emotions and the environment around us. I don't know if anybody has done mindfulness, but it does help if we do it correctly and do it on an ongoing basis. And really not, it's okay that we can't get to do everything. If you have a list of 10 things you want to get done that day, it's okay if you only get to do 5. It's okay, because you know what? The next day is coming. And so we have to prioritize the things that we need to do and what's important. Maybe you won't get to anything on that list, but what happens is that your child needs you. They need you to, help them with some homework. Where now children are, finishing up with school, but some children are going back to school in the summer virtually. But, what are we going to do with this time that they're now finished with school? Obviously, going on vacations is a little bit up in the air because, you know, there are requirements of wearing a mask and doing this and do that. But we know that there's places that people would fly to that they may not want to fly to. And now people may go back to doing the road trip just to be with their family and spend time with their family. And to really provide more calm and patience and more affection to ourselves as women. And we need to do that. I always say that we need to put our oxygen mask on first to give ourselves oxygen, because without it, how are we going to be able to take care of other people that are in our homes or in our household? And some people we know are also caregivers for their families, other adults that they may have in a home that they're caregivers for. And so there's a lot of things going on for many different people with many different situations. And so the other thing with mindfulness, you know, we can practice this in 6 steps. Here's a photo here. Taking a seat, feeling grounded. And Jeanne can certainly speak more to this, but putting your feet on the ground and noticing your body and feeling your breath. And so Jeanne, you want to like weigh in on this with the mindfulness and how people should do it appropriately?
Sure. Why don't we just do it?
Okay.
Is this a good time, Nicole, or did you want to wait till the end? Okay.
Yeah, we can try it now.
Okay, cool.
We don't have to do it for 10 minutes. We're going to do it for like a few minutes.
Yeah, a couple of minutes. So I invite, so I'm going to turn my video off.
Okay,
But I'll keep my speaker on. So I invite everyone to take a comfortable seat, readjust yourself if you need to. Plant both feet on the floor in front of you, or if you're seated on a cushion on the floor, wherever you're seated, however you're comfortable. Cross your legs or plant your feet on the floor.
Oh my God, finally. Thank you.
Please mute yourself. Please check to make sure you're muted. Thank you. I invite you to close your eyes or keep them open or half close your eyes. I invite you to bring both of your palms, place both of your palms on top of your knees so that your hands are cupping your knees. And let's take a deep inhale through your nose. And just exhale through your mouth. Make a sound when you exhale. Let's do that 2 more times. Inhale, fill your lungs all the way to the top. And exhale, make a sound with your exhale. 1 more time on your own. Inhale, fill your lungs. And exhale. Now drop your shoulders, purposely drop your shoulders down away from your ears. Relax your chin. Drop your jaw open just a little bit. Separate your teeth. Relax the muscles around your eyes. Relax the muscles on your forehead. Draw your attention to the spot right in between your eyebrows, center of your forehead. Breathe normally here, natural breaths. Relax your shoulders. Now think of your favorite color, whatever that color is for today or right in this moment. Your next inhale, breathe in through your nose that color. Like a streamer of your favorite color. Draw your favorite color into your nose, through your lungs, into your belly. Expand your belly. Your favorite color, like a balloon. Fill your balloon with your favorite color. Let it wash through your body, down through your legs, your feet, toes, up through your limbs, your arms. Hold that color into your heart and exhale slowly. Let that color stream out of your body into your room. Let it flow outside of your room, outside of the walls of the building that you're sitting in, out into your front of your house, back of your home, wherever you are today. Out into the world, healing breaths. Take another deep inhale and exhale. Set an intention here for the rest of your day moving forward. It can be an intention for yourself, for self-healing, or motivation, or resilience. It can be an intention for someone else or something else, or someplace else. Whatever your heart feels. Take another deep breath in. And this time, hold your breath for 5, 4, 3, 2, 1, and exhale. I invite you to wiggle your toes and your fingers. Maybe shake out your arms a little bit. Rotate your head side to side. Blink open your eyes if you had your eyes closed. Now draw your shoulders way up to your ears. Draw your shoulders all the way up to your ears. Drop them down. Nice and hard. Drop your shoulders. Open your eyes.
Thank you.
Smile.
If we were doing this in person, we would have done this. But it was good. Thank you. How did everybody like that? Soothing. Okay. Thank you, Jeannie.
Is everyone still awake?
Yeah, I think so. Yeah, you said it was good. Okay. All right. So let's go on. These are things that I can or cannot control. This is just things that we know we think about. We can control turning off the news. We can control our attitude. We can control our own social distancing and our kindness. We definitely cannot control actions of others, even though we would like to, but we can't. We definitely cannot predict things that will happen in motives of other people. And then, always the question, how long will this last? We don't know that. So, it's really, there's a lot that we have to think about all the time, every day. Healthy choices. We can control making healthy choices. We can control what we eat, our behaviors, washing our hands for 20 seconds, sleeping. Again, and as a woman, being a mom, and if you're working and things like that, getting adequate sleep, we have to work very hard at getting that sleep that we need. Exercising, as we said, eating fruits and vegetables or alternative, foods, supplements. Always check with your doctor. If you're going to take supplements, especially if you're taking medication, you must check with your doctor and make sure that it doesn't interact with the medication that you're taking. And also portion control. And there's that website, Choose My Plate, which will also give you the portion control. So just a little bit of information. As we said, this project has a focus on educating women around lead poisoning prevention and fetal alcohol. So we're just going to talk a little bit about those things. The doctor did touch on some of the things, a lot of things around the substance uses. I'm going to talk a little bit more about the fetal alcohol. And so what we do, we talk to women and within the community around those social factors around the environment and eating and those things. And we also talk about lead prevention. With lead prevention, to look at the impact of children, we know that children can have behavioral issues. Children should be tested for lead when they get their annual visits through a blood test, and a doctor will discuss the results with you. But we know that there's children that it can affect their brain, it can affect their behavior, learning disabilities, decreased muscle tone, anemia. It can affect their kidneys, the function of their kidneys, and damage their nervous systems. So we definitely want to ensure that families and there are things that have lead in it, like toys, jewelry. There's just everyday things. So we want to make sure that you read the label of what that item is made out of. It's really important because children, as we know, put things in their mouth all the time. And we know with adults, lead can certainly affect adults. Memory loss, headaches, digestive system. So if people are, and again, when you're an adult, there's a lot of other things going on that can affect our bodies, and we don't get lead tests as adults. But if you're living in an environment, a home that you know for a fact that there was still lead in the walls, you want to kind of tell the doctor that these are the symptoms that you're having, and if your child's experiencing those symptoms, maybe you could experience them too, but it has to be tested. We know that in New Jersey, there's been a campaign for many, 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 many years about getting the pipes fixed that lead into schools, and in our homes, just getting new piping, I guess that's what they call it, that are going into the homes and schools to ensure that we're not getting lead through different means through the water. And I know if anybody remembers this many, 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 many years ago, there was different areas of the state where they took away the water fountains, and they had kids bringing their bottles of waters to school because there was lead in the water. And so again, we want to make sure that we look at those. Get your house tested. There are free programs throughout the state of New Jersey that do lead testing in your homes. And so take advantage of those programs if that's the case, if you need to get tested. Alcohol and FASD, fetal alcohol spectrum disorder. So we've been doing this work around educating women around the effects of fetal alcohol. And we know that women should not drink alcohol while you're pregnant. We know that the doctor will say, well, you can have a glass of wine. But the medical studies show no alcohol at all. We also know that there's some women who could be drinking alcohol and not know that they're pregnant. But you should stop right away, because the effects, the long-lasting effects on that unborn fetus is where the damage will be caused. It could cause that child to have behavioral issues, mental health issues, learning issues, all those things. We also know that there's a high number of children who are within the child welfare system, that many times the families that receive a child in their home don't necessarily get all of the medical information about their parental parents all the time. So therefore, they may not know if their child has fetal alcohol spectrum disorder, even though they're exhibiting some speech issues, some developmental issues, social issues, because it looks like a developmental disability or a learning disability. And so there are different places in New Jersey, diagnostic centers. I don't know where all of them are, because I think some of them close, but specifically test a child for fetal alcohol spectrum disorder. And so we want to make sure that, if you know of women, and I don't know if anybody was seeing when you go into restaurants, they have a in the bathroom about drinking and smoking. Sometimes they have those signs up in the bathroom. But we have to remember, the bottom line is, when a woman is drinking, once she finds out that she's pregnant, she should stop drinking immediately. But if a woman continues to drink, she has to remember that that alcohol is crossing the placenta, which passes through the baby. And so we have to remember that that baby is going to be indirectly affected because of the alcohol that's passing through her. So that's her or him, of the baby. And so we want to make sure that if a woman is finding out she's pregnant, that she stops immediately. A few years ago, we had when we first started doing this project around the fetal alcohol education, we had a doctor, I'm not going to divulge her name, but and she came to speak to us about her experience with being an alcoholic. And she had 3 children, and because I think with the first one, she was drinking. She found out she was pregnant into the second trimester, and then she stopped. But that child was directly affected with some learning disabilities, some mental health challenges. Then she had another child that when she had stopped drinking when she found out she was pregnant. She was in the first trimester. She stopped drinking, but then now this is a doctor. And then she was clean for a little while, and then something triggered her. She went, she started drinking again, and eventually her husband, who's also a doctor, had to put her into a treatment facility. But then at the same time, finding out that she was pregnant, she was well into her second trimester, and then found out she was pregnant. All 3 of the children were affected by her drinking with different levels. The first child, who had a lot more things going on with the mental health, also had some medical conditions with some of his organs and things of that nature. We did find out about probably I think 3 years ago that first child, I believe it was the first one, had passed away because he had so many medical problems from being diagnosed with the fetal alcohol. And so, she has to live with that fact, and she's a doctor. So, alcoholism has no, it doesn't matter. It affects people of different races and professions and things like that. So we have to remember, and, we can't, telling somebody you need to stop drinking, we can just make them aware of what happens if you are pregnant and you continue drinking, what the damage could cause with the baby. And obviously they must speak to their doctor. All right. Especially, that's why they ask for family history. So if there was alcoholism in your family history, that's why they ask, because you're predisposed to those things. So it's really important that you have these conversations with the doctor. If you're working with women, obviously you have to tread carefully when you're having these conversations. But we always have to refer them back to their doctor, because they're the ones that they're directly working with for their medical, for when they're pregnant or pre-pregnancy, before, they're thinking about getting pregnancy, before they get pregnant. So we want to make sure that we prioritize ourselves, right? That self-care, it is not selfish. It's not a luxury. It's something that we should definitely do. It's definitely a component of our health. As I said, we cannot be effective with other people if we are not giving ourselves our oxygen. So it's really important that we give ourselves oxygen, which means taking time for ourselves. If you don't feel like cooking one day, that's okay, because I do it. I'm like, I'm not cooking because, I just don't, I don't have the energy. I don't feel like doing it. So, we have to practice self-care. and then create a list of different things that you want to do each week. If, did you start writing your journal? A lot of people started doing things that they couldn't get to before because they've been home. But some people started writing in their journals. Some people started reading their books more. Some people start realizing, especially for women, we needed to do more things for ourselves. And self-love, your mind, body, and soul. And so you probably can't see it too much. We're definitely going to get these materials to you. And writing yourself a letter, and just writing to yourself, and listing things that you're grateful for, buying yourself some flowers, reading a book, creating a vision board, just really things to do to pamper yourself. The best strategies to combat crisis stress. So here's some resources. There's a lot of resources out there for online mental health supports. You should definitely sign up for your county Department of Health office and the state Department of Health offices, because they put out a lot of information all the time about different resources that people can use, especially during this time of the pandemic. And also your county, like the county of which you live, they also put out a lot of resources. And so it's really necessary to utilize those resources, because if you're not putting your oxygen mask on by reaching out and getting those supports, then what's going to happen, you're not going to be good to be able to help your child or help your children or anybody else in your household. So really, and I don't know, it can be a struggle at times to be able to do that, but it's really important. If we feel like we are not feeling great about ourselves, or feeling sad, or feeling depressed or confused or angry, we really need to take hold of those resources that are within, the state that you live in. And here are some other resources. We have a lot of resources on our website. I believe the links were put into the chat box, but we will certainly get these other information to you. We mentioned about the the World Health Organization, local Red Cross, and there's a lot of other organizations providing emotional support that's out there. And again, lessen your time watching the news and really dealing with your emotions. Talk to your doctor. If it's your primary health provider, talk to your doctor about it, and they will refer you to, depending upon what insurance you have, they will refer you to the appropriate person. And here's a quote, because I love quotes. I love quotes. People who know me, I love quotes. And so I was looking at a quote for today, and self-love is making your physical, your mental, and emotional health a priority. So if one thing I want everybody to do today here, make yourself a priority. Whether it's your physical self, if you're doing exercises, your mental health, your emotional health, make your health a priority. And your medical health, right? Make sure you're getting to your doctor. Go to your doctor. Don't put off if you got an ache or pain or feeling that you've been like, just keep putting it away. Please get to your doctor. That's really important. And that story that sticks with me about the lady who was having all these kinds of pain and didn't know she was having a heart attack. And so it's really important that we pay attention to those feelings, those aches and pains in our body, and that we think was just normal, and it really wasn't. So we really need to have good communication with our primary health providers to talk about those things that we've been dealing with. So I want to thank everyone. And I also want to thank, and she's not on here today, but she's one of my staff person, Sakina Garrett. She's the one that created this PowerPoint for me. And so I'm just giving her props and thanking her for putting this together. She did such a great job on putting this together. And so I want to thank everyone for your attention today. It's, we put this together, and we wanted people to get really great information around mental health, self-care. And then tomorrow we're going to be doing ACEs, the Adverse Child Experiences, New Jersey AAP. And we're also having someone from Women's Space do a presentation on domestic violence and how it affects the children. So I don't know if there was any questions, Ayo, because I wasn't looking at the chat box. I was watching.
I don't think there were any questions, although since we, but just some requests actually. So we, and there's a question about tomorrow actually. So we will make sure that we go through the chat box and we will answer all the questions just in case we haven't, but we'll, you know, sort of put them in writing, and we will get you all of the resources. I see that people are asking about different resources in the chat box, so we'll make sure that we get that to you. There's a question about tomorrow. Will that be Susan tomorrow?
So tomorrow, for which one? For the New Jersey AAP, it's Aldina, and then for Women's Space, it's Abigail McGuire.
And people are loving the quote, Nicole. And someone asked for resources for the breathing resources. So I will get that out to everyone. The benefits of breathing, and you know, different ways of breathing for relaxation and meditation and mindfulness. And again, oh, how will we receive that? By email, right, Nicole?
I will email everybody who was on the registration. You will get it. And don't forget about tomorrow. You can use the same link. Another reminder will go out today to everybody for tomorrow. It's the same Zoom link.
So we look forward to seeing you all tomorrow if you're available. Please forward the link to others who you think may be interested to hear this tomorrow. And today's session, as Nicole mentioned this earlier, but today's session can be found, will be able to be found later on SPAN's YouTube channel. So it's being recorded. So that's great. So have a wonderful day, everyone, and thank you again for your time.